All right. Apologies for coming at this time. Actually, having some challenges with technical issues, and I'm glad to say we've sorted them out. Now, quickly, we cannot even have time for preambles and all of that because we need to squeeze in so many questions. But I'm glad to tell you, for those who were following last week, Dr. Vanessa Haruna is back with us. She did promise to be back, and she's here. And you know, last week we started with questions that you are too shy to ask your doctor. Some people sent in some questions, and I would like to start with those questions we received last week before we move on to others that I had received all along. All right, so Dr. Vanessa, it's great to have you with us in the studio. You're welcome. Great to have you as always. Welcome to Invicta once again.
Thank you very much.
All right, so just so that we also know, we're live on Facebook, so you can actually go there and join us real time. Let's talk together. Now, last week, someone sent in a text message and says, please, is there a specific sex position that determines the sex of a child? She actually talked about the male child, but is there a specific sex position?
Okay, there is no specific sex position that determines the gender of a child. Though there are so many theories that have been postulated, some will say, okay, shallow penetrative sex is associated with having female babies, while deep penetrative sex is associated with having male babies. While some will propose that, okay, when you have sex in so days during your menstrual cycle, you are likely to have a male or a female. All those are theories. The only way that the sex of a child can be determined is through in vitro fertilization. This one is a fertilization that is done outside, and then it is transferred into the uterus. So that's the only way in which the sex of the baby can be determined. But for sex positions, no, we are left at the mercy of God.
Okay, but it's actually scientific that male sperm are faster but die quicker, and female sperm are slower. Well, correct me if I'm wrong, but is this true? Is this scientific?
Yeah, it is.
It is, right?
Yes.
So that means that, well, some people have, there's a method to the madness. Some people say, if you want a girl, you have sex towards the beginning of your ovulation and then don't have any to give the slow but sturdy sperm that
like I said, all these theories. Yes, we are left at the mercy of God.
Okay, so nothing really sure. All right, so let's move on quickly. Last week also we had someone asking, if I have sex during my period, what are the implications?
Okay, the implications of having sex during your the implication of having sex during your period, number one, during your period, it gets messy. So it's one of the implications of having sex during your period.
Mm-hmm.
Also, during your period, the cervix dilates to an extent to allow the evacuation of the uterine contents that come out as those fleshy materials we see and the blood.
Right.
So during that time, when you have sex, you're at greater risk of having ascending infection into your cervix. Another implication is that during sexual activity, the orgasm is associated with contraction of the uterus. So when there is contraction, you have more flow, you have heavy flow of your menstrual flow, because the contraction helps to evacuate the uterine content.
Right.
So you may bleed for shorter days. Again, your sexual partner will be at high risk of getting infected with sexually transmitted disease like HIV, hepatitis, because all those are found in the blood.
Right.
And if you have these sexually transmitted diseases, you can easily get your partner infected.
Right.
Yeah.
Is it possible to get pregnant having sex during the period?
It's possible, because sometimes ovulation can coincide with the menstrual phase. They can intertwine. You wouldn't really know. And we know that the sperm lasts for some days
Right.
in the female system. So it's possible.
Okay. All right. So quickly moving on, we have, can a woman still conceive after an ovarian cyst operation?
Yes. In fact, I know some people that have conceived after ovarian cyst surgeries. Even if the woman had a surgery that involved taking off the ovary, and she's still left with one, which is very, very normal, and she has her tubes still intact, she can conceive.
Okay.
Yes.
All right, so these were the three prominent questions we got. Please don't send your text messages to the phone that we collect, that we receive your calls by, because it's harder when you're trying to read the text. Calls are coming in, so it's difficult to see your text messages that way. The best you can do actually is to send a text message to the number 09072703270. You send a text message there, either via WhatsApp or text message, and we'll get it. So let's move back to the questions that we've had from different listeners over the course of some time. Last week we stopped at number 10, for those who remembered, about the woman who farts a lot even when she's sleeping. Now the next question after that is, my wife says I snore heavily when I sleep, and she says she has heard it can cause heart attacks. Is this true?
It's true. There are so many causes of snoring, one of which is obstructive sleep apnea. So, in obstructive sleep apnea, people that suffer from that at night, when they sleep, they experience pausing of breathing. And when this happens, they suddenly wake up choking. This is as a result of decrease in oxygen level. Okay, usually snoring occurs as a result of obstruction in the flow of air in the airway. So when they experience this pause in breathing, the oxygen level declines. This sends signal to the brain. Some hormones are released, hormones like cortisol, adrenaline. So these hormones are risk factors for causing heart attack. They could also cause hypertension. They are also risk for people with diabetes mellitus. So for people that suffer from this obstructive sleep apnea, they are at risk of having this heart attack. Mind you, not everyone that snores has obstructive sleep apnea, and it's not in all cases of obstructive sleep apnea that one must snore. Then other causes of snoring could be posture. Sometimes when you're sleeping and you don't lie down very well, you could start snoring, but when your partner taps you and you adjust, you stop snoring. Then people that are stressed up in the day, when they sleep, they snore. And it's also common in people that are obese. Yes. Then people that have airway narrowing, they also experience snoring while they
Okay.
sleep.
Okay. There was something you said about sleep apnea. It's not everyone that has sleep apnea that really know that snores.
Those snoring.
So how would they know? Are they those people that just find themselves waking up in the middle of the night?
Yes, they pause.
Suddenly.
Yes, they pause suddenly. They wake up, they start choking. So once you experience this, it's good you go to the hospital.
So what kind of doctor do you go looking for?
You see otorhinolaryngologists. That's the ear, nose, and throat surgeons.
Okay.
Yes.
Okay. So we can get that at the general hospital.
Yeah, some of the hospitals have, in the hospital there are different departments depending on the type of hospital. Some of the hospitals you could find such a department, but we have the ear, nose, and throat center here in Kaduna.
Okay.
So you could do well to
Right.
visit there. We also
Okay.
have the ear, nose, and throat department in Barodiko Teaching Hospital.
Mm-hmm.
So if you have any of these challenges, you could do well to
go there.
Yes.
Just a quick one for your information. Of course, the Ear, Nose and Throat Hospital, the CABS, CAD Poly, the one close to the prisons, Kaduna prisons. There's the Ear, Nose and Throat there, just in case anyone out there is asking where it is. Now, let's move on quickly. This other question says, I feel dizzy every time after sexual intercourse, and then I have palpitations. Is this a sign of heart problems?
This can be a sign of heart problem, especially for someone that usually experiences chest pain. You have a history of maybe heart problems, hypertension, you have a family history of any heart problem, it could be a sign of an underlying heart condition. So it will be good you visit the hospital to see a cardiologist, so that if there is any underlying cardiac pathology you have, it will be diagnosed and prompt treatment will be made. But again, we know that sex is a rigorous activity, so it involves a lot of energy. People hyperventilate and the likes. So it's possible to experience dizziness after sex, especially maybe you were hungry, you didn't eat before that, you were dehydrated. It's possible to experience dizziness.
Right.
Again,
And a racing heart.
yes, a racing heart. Again, maybe you were in one position and suddenly you finished having sex, you didn't lie down to rest, and you just stand up.
Stand up.
You can experience dizziness, but where the problem lies is if this is persistent, maybe it lasts longer, and then you have those symptoms I mentioned earlier. So it could be a pointer to an underlying high heart condition. So you can do well to see cardiologist.
Okay, and do we have these services available at common hospitals around?
Yes, we do.
Okay, so that's great to know. I think you should also try to see a doctor. Let's move on to the next. This says, my stool is always very fat and big and does not easily flush away in the toilet unless I flush with a bucket. It even sometimes wounds my anus. I go to the toilet every day. A doctor asked me to drink water first thing every day, but it has not helped me. Is this normal?
This person may be constipated, and there are so many causes of constipation. Sometimes our eating habits, the diet we eat, most of us, we eat refined foods like pasta, we take a lot of snacks, we don't eat food that have high fiber, we don't eat high fiber diets like vegetables, fruits. So this can make our stool to become very hard. Then some of us have the habit of not taking water. Water helps a lot. It helps in to soften our stool. And some of us have the habit of, when we feel as going to the toilet to stool, maybe because we are watching something interesting or doing something, or we are not in our homes, we just try to
Hold it.
to suppress it and hold it. Now when you even get home and you want to go to the toilet, you don't even feel like it. These are reflexes. So in the process, the undigested food particles will stay longer in your intestines, and they will absorb the water content. They will become hard and impacted, and this will make it very, very difficult for you to pass stool. When you go to the toilet, you have to strain. Sometimes when the stool comes out, it tears the lining of your anus, and this can predispose you to bleeding. But mind you, when this becomes constant and you bleed a lot, it will be good you go see the doctor, because you go see a gastroenterologist, because this could be a pointer maybe to an underlying condition. So for such kind of people, you can do well by taking lots of water, eating high fiber diets. Whenever you feel as defecating, passing stool, you go to the toilet at that time. But there are other medical conditions that can cause this constipation.
Like what? Quickly.
Like irritable bowel syndrome. It could be as a result of and it's also good to note the stool. Sometimes it can be fatty. So stools that are fatty usually float and are difficult to flush. So that can be a pointer.
But can a fatty stool cause torn anus lining? Tearing the anal lining, would fatty stool cause that? Can it cause that?
No, it cannot cause that.
Okay.
I was just adding to
Okay.
yes.
Okay.
Because the person said finds it difficult to flush the stool. So in such instance, you may note, if you also notice sometimes the stool is fatty, it could be as a result of acute pancreatitis, inflammation of the pancreas, which releases enzymes to help digest fats. So once you notice that, and it's not as a result of those factors I mentioned earlier, you can do well and to go see a gastroenterologist. Of course, if your stool is hard, it becomes difficult for it to pass through your anus. It becomes flat. So it's just normal sense that you require a lot of water to flush bulky
stool.
Yes. So
All right.
that's the cause.
Okay. So, of course, you do know that we'll open up the phone lines. We still have just a few more questions to go, but let's go on a quick commercial break. And when we get back, those few questions in short order, and then we will be hearing from you. You're listening to Your Health 360 on Invicta 98.9 FM. Do stay with us. Your Health 360. All right, thank you for staying with us through that commercial break there. Still with you on the program Your Health 360 this evening. And Dr. Vanessa Haruna still in the house taking our questions. So like I said, let's ask in short order the next few questions so that we can open up the phone lines. The next question here says that whenever I sit down, especially on a hard surface like the ground, a bench, or on a stool, both my buttocks muscles hurts me so much. I sometimes scream from the pain. It is not from exercise. What is the problem?
It could be as a result of muscle strain. Our buttocks, we have muscles in our buttocks, and these muscles can get strained, so they can cause pain. We also have nerves, we have blood vessels, and we have other structures. Like there's this thing called the piriformis syndrome. Is as a result of straining of a muscle in the buttocks called piriformis muscle.
Okay.
This irritates a nerve called the sciatic nerve. So this can cause pain in the buttocks. Also, there is this thing called sciatica. There is this nerve that runs from the lower back through the buttocks to the knee. Once the nerve is irritated, it causes pain along its course. So the buttocks is one of the places where we can feel that pain. Herniation of disc in the spine can compress this nerve, and this can cause pain in the buttocks. Abscesses can also cause pain in the buttocks. There are structures, like I said, in the buttocks. There's the bursae, ischial bursae. It can become inflamed, and it can cause pain in the buttocks. Then we know the buttocks is related to the hip. Once there is inflammation of the hip bones, like sacroiliitis, arthritis of the hip bone, it can also cause pain in the buttocks. So for such person experiencing pain, you can do well to see a doctor. There are pain reliefs that can be given to you, muscle relaxants that can be given to ease this pain.
So that means that the muscles of the buttocks there are contracted, they're not relaxed. Is that what we're saying? And the piriformis, you called it a syndrome, and usually when doctors call something a syndrome, that means they really do not understand why it happens.
It's the piriformis syndrome is as a result of irritation of the sciatic nerve by the piriformis muscle. When the piriformis muscle becomes strained, it compresses the sciatic nerve. So that's why it is called piriformis syndrome. So it causes pain in the buttocks.
Right. Okay.
Yes. And for this person that says he or she sits on hard surface, you can do well by sitting on cushioned surface to help reduce your pain. And if you're exercising and this pain comes up, you can do well by resting, and reduce your exercise time. Then you can see a doctor so that pain reliefs and muscle relaxants can be prescribed to you to
Okay.
ease your pain.
Okay. All right. So let's move on quickly to the next one, which will be the last before we open up our phone lines. This person says, "My wife's mouth smells a lot. I have bought all types of toothpaste. She brushes her tongue well and changes her toothbrush often. Could there be another reason why she has this bad mouth odor?"
Yes, there could be other reasons that can cause bad mouth odor. Um, Infection of the gums can cause bad mouth odor. Um, when you have cavities in your teeth, um, these cavities can lodge food particles and bacteria can build up there. And when they break down these food particles, sometimes brushing may not reach those places. It could cause mouth odor. Some nose and throat infections cause postnasal drip. Mucus build up at the back of the throat, so they can be medium for bacteria to grow and they cause foul smell in the mouth. So it's also another possible cause. Then sometimes some diets like garlic, though you may brush your teeth, but once they get digested, they cause this offensive mouth odor. So it's also another cause. Um, for such, also there's this thing called dry mouth, xerostomia. We know the saliva in our mouth helps. It helps in cleansing the mouth. It has bactericidal effects. So for those people that don't have enough saliva in the mouth, they are predisposed to this mouth odor. Sometimes it could be a pointer to some metabolic diseases. So for such kind of person that has tried um, using all the mouthwash, the antibactericidal toothpaste, you can do well to see a dentist. If it's as a result of um, infection of the gums or the teeth, they can find the cause and it can be treated. If it's maybe as a result of an underlying medical condition,
Hmm.
they'll direct you to see a physician so that that too can be identified and treated.
All right. While we're trying to access the our Facebook page to see if we have any comments, I would like to open up the phone lines at this time so that you can ask your questions of Dr. Vanessa, who is here to answer questions that we're too shy to ask our doctor face to face. Okay, so let's go take your calls now, and the lines are open. The numbers are 081 40,000 989. Once again, that's 081 40,000 989. Then we also have 070 87800 989. That second number, once again, is 070 87800 989. Taking your calls this evening. Hello, good evening.
Hello, good evening. My name is Samuel.
Yes, you're
I'm calling
welcome.
from Narai.
You're welcome. Go ahead.
Please, doctor, I want to ask a question.
Okay.
What causes hepatitis?
Okay.
And what is the what person can be able to stop to if you have hepatitis? What can be able to stop? And let me just say, if the doctor say you will not eat this and will not eat this, all things that you will not eat, is it compulsory that you must eat any kind of food, or it's not compulsory?
Okay.
That's my question.
Okay. And thank you very much for your question this evening. Still taking your calls. Let's take another. Dr. Vanessa, you're taking down notes of the questions so that you don't forget. Let's go take another call now. Hello, good evening.
Hello, good evening, ma.
Yes, you're welcome.
Madam.
Yes, you're welcome. Go
Yes,
ahead,
ma'am.
please. Go quickly.
So I just want to greet you for doing good work, sir.
Thank you so much. It means so much to me.
Yes,
Thank you. Thank you. I really appreciate you spending time and money to call me and let me know. Thank you so much. We appreciate you too
Okay,
for
thank you,
staying
ma'am.
with us. All right.
Bye.
Still taking your calls this evening on Invicta 98.9. Hello, good evening. Okay, that call got caught. But let's come back. While we're waiting for other calls, let's talk about what causes hepatitis. And, does it make sense when your doctor tells you to stop eating something simply because of this?
Yes, hepatrophic viruses cause hepatitis. And it is good to adhere to instructions that are given to you by your medical personnel, because they know the implications, and before they even give you those instructions, they explain to you the reason why, and they advise you. So it's good to adhere to those instructions.
Okay. So it makes sense when doctors say don't eat this or don't eat that.
Yes, there are disease conditions that eating some particular type of food can worsen
it.
Yes.
All right. Still taking your calls this evening. Hello, good evening.
Good evening.
You're welcome.
Calling from.
Your line isn't clear.
I'm Jane calling from Cameroon.
All right, you're welcome. Go ahead.
Thank you. Last week I sent a text message. It's a question about sex position, if it determines the sex of a baby.
Okay, I think you joined us. You didn't join us from the beginning, right? Because I took those questions first, but Dr. Vanessa will answer. She will still answer you. Is that your only question?
Yes, that is it.
Okay. All right. So thank you very much for calling in.
You're welcome.
All right. Have a great evening. Dr. Vanessa, we had that person who called calling in again. I think she didn't join us from the beginning.
Okay.
So she's asking once again that can sex position determine the sex of a child? Hello, good evening.
Hello?
Yes, you're welcome, madam.
Hello, good evening.
Good evening. Go ahead with your question.
I'm asking about my body will be shaking sometimes. My stomach, if I'm feeling hungry, my stomach will be paining me from my stomach to the chest.
Okay. Is it only when you're hungry?
Yes, ma. I'm calling from Narai.
Okay. Is it only when you're hungry?
Yes, if hungry catch me small time,
okay,
if my body will be shaking me, and if I eat the food again, more time I will be feeling hungry again.
Oh. Shouldn't somebody's body shake when you're hungry? All right, Dr. Vanessa will answer. Thank you for calling in this evening. Still taking your calls, trying to take as many as we can before we have to go this evening. And the numbers remain the same. They are 081 989 and 07087 800 989. Hello, good evening.
Hello, good evening.
Yes, you're welcome. Your question?
Joy from Nigeria.
Okay.
I want to know, can someone still be traumatized like after 4 months of giving birth?
Traumatized?
Yes, like depressed.
Okay, depressed, right?
Yes, let me just be depressed, yes.
Yes, that's a real thing. But can you just try to... Are you the one?
Yes.
Can you just describe to the doctor quickly how you feel? To give her a better idea.
Sometimes I don't know, I think a lot of negative things, like, as in, I can't really explain, but I just know that I'm just depressed, I'm not happy, some things make me feel sad. I don't know.
Is your baby still your baby is with you, right? Your baby is fine?
Yes.
Okay.
She's fine.
Okay. So that's a very real thing. All right. So just the doctor will answer you. Thank you very much for calling. And please listen very well. You really need to listen to what the doctor is saying. What you're going through is a very real, and there's present danger if it's not treated. Have you spoken to your husband about it?
No.
Well, you need to talk to someone about it. All right. So let me allow Dr. Vanessa to talk to you. Dr. Vanessa, do you have any questions for her before she goes off?
I'll talk about it.
Okay. All right. So if you have any questions after Dr. Vanessa answers your question, please just send whatever your thoughts are, please, particularly to you, this lady that just called now. Just send me a message later if you're not clear. So Dr. Vanessa.
Before you go off,
Okay.
Are you still online?
Hello?
Okay.
Are you okay? She's
I'm
still here.
like,
Yes.
Okay, but are you aggressive towards your baby?
sometimes I'm just, sometimes towards my husband. Then
Okay. All right.
How old is your baby now?
she's 4 months.
Okay.
All right. We'll talk about it.
Okay.
You're welcome.
Thank you.
Take care.
Take care.
Yeah. That's a real present condition that we often don't talk about. A lot of people just think, "Oh, you should be happy. You have a baby. You should be happy." But it's a real condition. Let's take your call and then we'll come back to Dr. Vanessa. Hello, good evening.
Good evening, ma.
Good
My
evening.
name is
You're
Abigail.
welcome.
I'm calling from Nigeria.
You're welcome. Wow. So a lot of people from Angwa Megera are listening this evening, it would seem. Go ahead. What's your question?
Ma, my question is that I used to have catarrh. It's been 3 years now, but I didn't see a doctor.
Why?
So I didn't.
You mean you've been having catarrh consistently like that without stop
Yes.
for 3 years?
Yes,
And you've not gone to see a doctor?
yes.
Not even a public hospital? Why?
Because last year I wanted to go, but this issue of corona, so that they will not say that. But I've tested for this thing for corona.
Yeah, and it isn't. Right, cannot be
Yes.
corona for 3 years back to back
Yes.
to the,
Mm.
all right.
Mm.
Okay, so Dr. Vanessa, at this point the questions are enough. Let's hear from you.
Okay. Let me just start with the question on sex positions. Sex positions do not determine the gender of your baby. Like I said, we are left at the mercy of God, except for those ones that undergo in vitro fertilization. For such people, they can select the gender of their baby, but sex positions do not determine the gender of the baby. Whatever sex position you take, you could either have a male or a female baby. There's this question on sharp pain in the chest and then shivering.
Yes,
When she's
especially when
hungry.
she's hungry, and then when she finally eats, there's pain.
Okay, of course, when we are hungry, some people can shiver. It's as a result of hypoglycemia because your glucose level is low. But when you eat, that will stop. For the chest pain, she said she's having when she's hungry. That was what she said. When she's hungry, she feels this pain. When you're hungry, the acid in your stomach, the levels are increased. So this can cause pain in the chest, especially in those that have dyspepsia. They are suffering from peptic ulcer disease. So please don't allow yourself to always get very hungry before you eat, because you're exposing your stomach lining to the gastric acid, which can cause erosion of your gastric lining and predispose you to having ulcer. Ulcer symptoms can present with chest pain. So please, she should always not allow herself to go very hungry to the point that she's shivering before she eats.
Okay.
Yes.
And then she talked about the food, like quickly she feels hungry again. I think she said something like that. She says after she eats, then it's not long, she starts to feel hungry again.
So that is relative. That is relative.
Yeah.
Yes.
So it cannot be a problem of worms.
Worms. Not really. Yeah, it could be actually. It could be. But in her context, the way she said it, I feel it's maybe her own definition of
How soon she starts
Yes.
to feel hungry
Yes.
again. Well, if you're not satisfied, you see, the bottom line is these programs are just to raise your awareness, not to treat you at home. It's just to give you an idea about what is going on. Okay, so please.
But if she's worried about that, she can come to the hospital.
Right. I
so
think
that
would
more
be better.
history will be taken and
Yes.
The cause will be identified and appropriate treatment will be given.
Okay, are you through? We have other calls.
Okay, no, there are other questions.
Okay.
Now for the lady with the catarrh for 3 years, she said.
Right.
There are so many causes of catarrh. If it's as a result of allergy, the allergy will have to be identified. That means she may be having allergic rhinitis. So if these allergens are not identified and she's constantly being exposed to it, she can be having this catarrh constantly. But I will advise you, since you said you've been having it for 3 years, because those that have this allergic rhinitis, it's from time to time, it's not something that is constant. So I will advise you to go see the ear, nose and throat surgeon so that the cause will be identified and treated.
Okay. All right. And then the lady with apparently
Yes.
postpartum depression.
Yes, it's a common thing that is seen among women. Yes, it's very common. So, but one good thing is for her to have identified that actually she has this depression and it's something of concern. So I will advise you, because it's not something that can be treated at home, please do well to see a psychiatrist to help you out. Yes.
So, Joy, please, I could connect you with a psychiatrist. You need to talk to your husband, though. Someone that you really, really, that you feel will understand. Because Africans, we have a way of saying, God blessed you with a child, child that many people have used money and all of that they didn't get, and you're sad. But it goes beyond just, it's outside her control.
Yes, because it's not normal, actually. It's not normal to be having depression. You're aggressive towards your child. Some of the women they hurt those babies.
Yes.
They become very aggressive. One thing I want you to know, Joy, the fact that I said you should do well see a psychiatrist doesn't mean you're mad, because some of us have this perception that whenever someone is going to the psychiatry to see a doctor there, it means he has a very, very serious
mental problem.
Yes, or the person is going mad. What will people say about me? Please don't bother about all these things. Do well to see a psychiatrist. It will be of great help to you.
We all need help.
Yes.
Just like every part of our body that grows ill. I did tell, for those who follow this program, I actually paid a visit to the psychiatric hospital, and I told you I wanted to take videos, but because of patients' privacy, I couldn't. But I went there, took, the doctor ushered me, showed me the reception and all of that. So it was a really great experience, and there's a lot of work going on in our neuropsychiatric hospital. So many wings springing up. It's a beautiful thing. You should come to Banawa and see it. Please, Joy, we'll call out my number once again, so that if you need for us to connect you with a doctor, we can do that. But you could also just go to the neuropsychiatric hospital and just complain. Buy a card and just complain. Please, what you're experiencing is a very serious thing. Please try to ensure that you go to the doctor. We've run out of time, but we can take maybe two more calls. Yes, hello, good evening.
Yes, my Blessing calling from Angon Sunday.
All right, go ahead. You're welcome, Blessing. And
Yes,
do you know, funny enough
younger-
today, a lot of females calling. Very unlike them. They usually don't call. So welcome. I'm really happy. So go ahead.
Thank you, Ma. It's my younger sister. Her throat is disturbing her, and she's having this catarrh. When it is rainy, she always cough. And when the weather is calm, she's okay. When the weather is cold, she's always coughing. So I don't really know what is the problem. And the side of her neck, that is the right hand, there is a vein connect from her brain to her neck. That place is a little bit swelling. So I don't really know
On
what
the
is
side of the neck.
problem.
On the side of the
Yes.
neck. And the vein is
Yes.
looking pronounced.
Yes, till you touch her neck, you feel the difference from the left and the right side of the neck.
Okay.
So it's a
Okay.
little bit swelling, a little bit.
All right.
There is a vein being connect the head and the neck being the
Okay.
shoulder side.
Okay. All right.
Yes,
Is
ma'am.
there any question you want to ask her before she rings off?
Okay, no.
Okay.
Yes.
All right. So thank you very much.
Thank you,
The
ma'am.
doctor will answer your question. Still taking your calls this evening. We could add one more before we have to go, but Dr. Vanessa, you go on this particular question.
Okay.
Okay, please hold on. Let me just take this and then we know we're done. Hello?
Good
Hello?
evening.
Yes, good evening. Quickly, please. You're
Uh,
welcome.
this this is a question from
You're welcome. Go ahead.
I want to ask a question, please. Can someone have infection and not see any symptoms or signs,
What kind of infection?
like sexual infection, not see any symptoms or signs for months? Is it possible?
Okay. But has the person had unprotected sex?
Yes, yes.
Okay. And the person just feels that they have some infection. Is there any reason why?
No, like I didn't feel anything, but I'm just being paranoid that maybe there might be something, but I've not
Okay.
really felt anything in my
Okay.
body
Okay.
system.
Okay. All right. So
But,
thank you. Thank you
okay.
for calling. Any other question?
No, that's all.
Okay. So thank you very much for calling in this evening, Dr. Vanessa.
Yes. For the lady with um seasonal, I'll call it seasonal catarrh.
Mm-hmm.
It could be as a result of allergy, like I mentioned. So please, she should do well to go see our ENT surgeons.
Could allergy cause that kind of swelling?
No, I'm talking about the catarrh for now.
Okay. Okay.
Yes. So so that the allergen will be identified and um exposure to it will be stopped in time. Yes. For the swelling she's talking about in the neck, it could be anything. So it's best if she is physically examined, so that it will be ascertained and whatever it is will be clearly identified.
Mm,
So she should please do well to see a doctor.
right.
Yes.
Please, it's very important. The way Dr. Vanessa say you will do well, you will do well. It's more than do well. It's very, very important that you go see a doctor. I know all of us are talking about money, 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 but honestly, it's better for us to hustle and be looking for money that we're owing than for us to leave that sickness to become so bad before we start to look for solutions. Yes, our last caller.
Yes, it's possible to have sexually transmitted infections with no symptoms. It happens. Yes. So, but if you're not convinced and you're not comfortable that and you feel you may have any form of infection, you can do well to go to the hospital and get yourself and have investigations done on the various
So what do you tell
sexually
the doctor?
transmitted
I had
infections.
unprotected sex
Yes.
and I need to just clear myself.
I just want to run these investigations to be sure that
Right.
I'm not having any of them.
Right.
So that in case, even if you have any and the symptoms have not started manifesting, it will be identified early and treatment will be administered to you very early before they start causing one or two damages.
Issues.
Yes.
Right. Just a quick one. HIV is still very much with us, and HIV doesn't show for face, like we love to say, until much, much later when it's almost too late. So, just taking the words out of doctor's mouth, please use a condom if you know that you cannot go with abstaining from sex. This isn't the time at all. With all the super infections we're having all over the place, this isn't the time you want to have unprotected sex, especially if it's not with your spouse or a partner that you know you understand what both of you are doing. So, Doc, your last line for us as we ring off this evening. Yeah, you heard all the questions, so your last line.
Please don't be shy of asking your doctor any question. Whenever you have anything that you need clarification or you're not okay with, please don't just stay at home. Most of these things cannot be solved at home. You need to go to the nearest facility, see a doctor. Don't be shy. We are here for you. That's why we are there. Tell us everything the way it is, because most of these diseases are like criminals that you need all the thrills you can gather to be able to catch them. So please do well. Go see your doctor. Explain everything. Do not hoard any information, because that information you're hiding may be that thrill that the doctor is that the doctor needs to hit the nail on the head. So please do well. See your doctor so that early treatments can be
All right.
given. Yes.
MC Particles, Jeff, for the place is coming up. So all the guys are in the house and they are eager to come take over the seat. At this time, I would like to say thank you so much for listening from last week to this week. The lines are still buzzing. Cannot take any more calls. Until next week, let's just get to the doctor. It's very, very important. Particles, I see you for the place coming up. I cannot wait to hear what they have for us today. You're still listening to Invicta 98.9. Have a victorious weekend, people.